What if the most effective way to fix a malfunctioning internal thermostat isn't a pill, but actually tricking your brain with a blunt needle that doesn't even pierce the skin?
Right, which sounds, it sounds totally counterintuitive.
It really does.
Yeah.
But for about 75% of women navigating menopause, that internal thermostat doesn't just malfunction, you
Mm.
know, it completely breaks.
Oh, absolutely.
You're sitting there, maybe you're in a high-stakes meeting, or maybe you're just trying to get through a single night of sleep, and suddenly your system just goes rogue.
Yeah.
You get this overwhelming, like, suffocating wave of heat, the hot flashes or flushes and the drenched sheets that come with them.
And if you're one of those women, you know this is far more than just getting a little warm.
Exactly. You are probably looking for a way to fix that broken system, and increasingly, people are looking for non-hormonal natural remedies to do it.
It is so vital to understand the sheer severity of this right from the start, though.
Yeah.
We call them vasomotor symptoms, which is the clinical umbrella term for hot flashes and night sweats. But calling them symptoms almost downplays the impact.
It makes it sound like a mild cold or something.
Right, but they actively disrupt daily executive functions. They impact social confidence. And perhaps most devastatingly, they destroy sleep architecture.
Which ruins everything else.
Exactly. When your sleep cycle is constantly fragmented by waking up covered in sweat, your body never enters those deep, restorative phases of rest.
Wow.
And that sleep deprivation cascades into severe anxiety, chronic fatigue, and just a massively reduced overall quality of life. It's a systemic hijacking.
And that is exactly why we are jumping into this deep dive today. We've got a massive stack of clinical trials, Cochrane reviews, and meta-analyses to get through.
Lots of data.
So much data. And our mission is basically to answer one highly debated question. Does acupuncture actually provide measurable physical relief for these vasomotor symptoms, or is it just an elaborate, deeply relaxing placebo?
It's a great question.
To figure that out, we have to understand how this intervention is theoretically supposed to work. And looking through our sources, what's wild is that we are essentially analyzing the exact same physical action, right?
Right. Sticking tiny needles into the skin.
Yeah, but through two completely different conceptual lenses, like ancient philosophy on one side and modern neurology on the other.
We really have to look at both to see the full picture.
Okay, let's start with the ancient side.
Sure. So, the traditional Chinese medicine view, or TCM, operates on an entirely different diagnostic framework than Western biology.
Right.
In TCM, optimal health is dictated by the unobstructed flow of vital energy, which is known as qi.
And that moves through the meridians, right?
Exactly. It moves through 20 distinct pathways or meridians across the body. So when they look at menopausal hot flashes, they don't see a hormone deficiency.
Right, because hormones aren't really a concept in that framework.
Exactly. They see it originating from a very specific systemic imbalance called a kidney yin deficiency.
Oh, I was reading about this in our notes. In this philosophical framework, the kidney system is basically considered foundational to the body's cooling and moisturizing functions, right?
That's right.
So when there's a kidney yin deficiency during menopause, it's like the coolant reservoir runs dry.
Yes.
And that lack of cooling creates a cascading imbalance that ripples out to affect like the heart, the liver, and the spleen.
And that lack of cooling generates an excess of internal heat, which TCM practitioners sometimes refer to as heart fire.
Heart fire, that sounds intense.
It does. To combat this, the acupuncturist identifies specific points along those meridians points that correspond to those affected organ systems.
Okay.
By inserting the needles, the goal is to release the blocked qi, essentially venting that heart fire, and restoring the natural harmony and temperature balance between the internal organs.
That's very holistic.
Highly systemic. It views the hot flash as a symptom of a larger environmental imbalance inside the body.
So in that ancient vocabulary, we are unblocking rivers of energy to extinguish a fire.
Beautifully put, yeah.
But Western medicine, I mean, they don't recognize Quinmer meridians at all.
No, not at all.
They look at those exact same needles going into the exact same spots on the leg or the abdomen, and they see a purely biological reaction.
Right. When we shift to the neurophysiological lens, the explanation centers entirely on the hypothalamus.
Okay, let's talk about the hypothalamus.
During menopause, the drastic drop in estrogen levels triggers a concurrent drop in the level of endorphins circulating in the hypothalamus.
So if we think of the hypothalamus as the brain's central processing unit, like the CPU, it's like a bad software update has suddenly corrupted the temperature sensors.
That is a perfect analogy. Because those endorphins drop, the CPU starts panicking.
It's flying blind.
Exactly. It triggers an erratic release of other neurotransmitters, specifically serotonin and norepinephrine.
And what does that do?
This chemical chaos essentially lowers the body's temperature set point. Your brain is suddenly receiving faulty data. It thinks we are severely overheating, even when you're just sitting in an air-conditioned room.
Oh.
To prevent what it perceives as imminent heat stroke, it triggers a massive, system-wide cooling protocol.
Which is the flush.
Right. It forces the blood vessels near the surface of your skin to dilate rapidly, flushing the skin with blood to radiate heat away. And it triggers the sweat glands.
So the hot flash is actually your body aggressively trying to cool you down from a fever that doesn't even exist.
Exactly.
That's crazy. So how does poking the skin with a tiny needle fix that corrupted CPU?
It acts as a forced reboot of the nervous system.
Or reboot.
Yeah. When an acupuncturist inserts a needle into highly specific points, like SP6 on the lower leg or CV4 on the abdomen,
Right.
it creates a microtrauma.
Okay.
And that microtrauma triggers what are called antidromic axon reflexes.
Antidromic axon reflexes.
Yes. This localized physical stimulation sends a rapid signal up the spinal cord directly into the central nervous system.
Oh, I see.
That signal stimulates central opioid activity, prompting your body to release a surge of its own beta endorphins.
And those beta endorphins travel back to the hypothalamus to replace the ones that were lost by the estrogen drop.
Precisely.
So you're basically pressing a peripheral neurological button to manufacture your own homemade painkillers, which then flood the CPU and tell the temperature sensors to just chill out and recalibrate.
That's exactly what's happening. And beyond just the endorphins, researchers have measured other concrete biochemical changes too.
Like what?
Well, acupuncture has been shown to significantly decrease the urinary secretion of a molecule called CGRP.
CGRP?
Yeah, calcitonin gene-related peptide.
Okay, and what does that do?
CGRP is a potent vasodilator. It's one of the primary messengers that tells your blood vessels to open up and cause that intense flushing.
Oh, wow.
By suppressing CGRP, the needles are physically cutting off the communication lines that trigger the flush.
That makes so much sense.
Right. Both the Eastern and Western lenses arrive at the exact same physical intervention. They just use completely different vocabularies to explain the mechanism.
Okay, so when you look at that biological mechanism, it sounds incredibly precise. You press the button, the beta endorphins release, the CGRP drops, and the thermostat resets.
On paper, yes.
But when we actually look at the clinical data from the trials testing this on women, the results are wildly complicated.
Very complicated.
If we just look at the study supporting acupuncture, the numbers are fantastic. Like, I'm looking at the AIM study conducted by Wake Forest and Duke University.
A very well-known study.
Yeah. They tracked over 200 perimenopausal and postmenopausal women. The group that received real acupuncture saw nearly a 36.7% reduction in their vasomotor symptoms at the 6-month mark.
Which is significant.
And what's crazy is that those cooling effects lasted up to a full year.
And we see similar positive outcomes across multiple international studies, too.
Right.
For instance, a Danish trial tracked women with moderate to severe symptoms. After just 5 weekly treatments, 80% of the participants reported significant beneficial effects.
80%.
Yeah. And an Iranian clinical trial zeroed in on sleep, showing that acupuncture didn't just reduce the hot flashes, but it vastly improved sleep latency.
Meaning they fell asleep faster.
Exactly. Drastically cutting down the amount of time it took these women to actually fall asleep after hitting the pillow.
Okay, but wait. I'm looking at the notes from the Australian study here, and the math isn't adding up.
The Australian study.
Yeah, they tracked over 300 women. The group getting the real Chinese medicine acupuncture saw about a 40% improvement in the severity and frequency of their hot flashes.
Which matches the Wake Forest data.
Right. But the control group, the women who were supposed to be getting the placebo, they also saw a 40% improvement.
Yes.
The fake needles worked exactly as well as the real ones. How is that possible?
This is the phenomenon of sham acupuncture, and it is the center of a massive ongoing debate in the medical community.
I can imagine.
Think about it. In a high-quality pharmaceutical trial, you give the control group a sugar pill that looks exactly like the real medication.
Right, so the patient doesn't know what they're taking.
Exactly. So you can isolate the chemical effect from the psychological expectation. But how do you create a placebo for a physical intervention like a needle?
Right. You can't exactly sneak a needle into someone's leg without them noticing. So how do researchers fake it?
They use specialized blunt needles.
Blunt needles.
Yeah. These sham needles are designed to retract into the handle, sort of like a stage dagger.
Oh, that's clever.
They press firmly against the skin, giving the patient the distinct sensation of a prick, but they don't actually pierce the dermis.
Okay.
Alternatively, some trials use real needles,
Right.
but insert them very shallowly into random locations on the body that are not recognized acupuncture points.
But if a blunt needle that just pokes the skin without breaking it delivers the exact same 40% reduction in hot flashes,
Yeah.
aren't we just measuring the power of positive thinking here?
That's a fair question.
I mean, is this whole thing just an incredibly expensive, elaborate placebo?
That is the multi-million-dollar question. To get a clearer picture, researchers conduct meta-analyses, pooling data from dozens of individual trials to see the overarching trends.
Right.
A massive Cochrane review analyzed data from over 1,100 women. Their conclusion was striking.
What did they find?
When comparing real acupuncture to sham acupuncture, there was zero statistically significant difference in the frequency of hot flushes.
Zero.
Zero. The real needles did not stop the flushes from happening any better than the fake ones. They did note a marginal reduction in the severity of the flushes, but the overall frequency remained statistically identical between the two groups.
And the PLOS meta-analysis found the exact same thing, right?
Yes, they did.
They looked specifically at over 800 breast cancer patients. Real needles versus sham needles resulted in no significant difference in how often the hot flushes occurred or how severe they were.
But the PLOS study highlighted a really confusing contradiction. Despite the math showing the flushes were still happening at the same rate, the women receiving the real acupuncture reported a highly significant improvement in their overall menopausal symptoms and their general quality of life.
So the flushes didn't stop, but the women felt significantly better anyway.
Exactly. And this forces us to confront a major flaw in how we design these trials.
What do you mean?
Many experts argue that sham acupuncture is an inherently flawed placebo
Why?
because a sugar pill is completely physiologically inert. It does nothing to your body. But a blunt needle, firmly pressing against the skin, is not inert.
Oh, I see where you're going with this.
The human autonomic nervous system is incredibly sensitive to touch and localized pressure. Even if the skin isn't pierced, that physical pressure on the nerve endings triggers minor physiological reflex effects.
So it's an active placebo.
Yes, you are still physically treating the nervous system, just in a milder way.
That totally changes the context. If the control group is also getting a mild form of the treatment, of course the results are going to look similar. But even beyond the physical pressure of the blunt needle, we have to look at the perspective of clinical organizations like the Women's Health Clinic.
Right, the clinical perspective is key.
They emphasize that even if the rigid clinical trial data is heavily mixed on whether acupuncture definitively stops the mathematical frequency of the flushes, the patient experience cannot be ignored.
It absolutely cannot.
Women consistently walk out of these sessions reporting that they feel drastically better, they are less anxious, and they're finally sleeping through the night.
And we cannot discount the profound impact of the therapeutic ritual itself.
The ritual.
Yeah. Think about the environment of a modern doctor's office. It is often rushed, clinical, and stressful.
Very true.
Now contrast that with an acupuncture session. You are brought into a quiet, softly lit room. You are given the space to lie down and rest completely uninterrupted for 20 to 30 minutes of deep relaxation.
That sounds amazing on its own.
It is. In fact, a significant portion of patients actually fall asleep on the table while the needles are in. When you combine that deep, enforced physical rest with an empathetic, supportive relationship built with a practitioner who is taking the time to listen to your symptoms, you are providing a powerful neurological intervention for stress.
It reminds me of the concept of contextual healing.
Okay, tell me about that.
Like, if I am having an absolutely miserable, highly stressful week, and a friend invites me over, makes me a warm cup of tea, and just actively listens to me vent for an hour.
Right.
That cup of tea isn't a pharmaceutical compound. It doesn't chemically alter the structural problems of my life.
No.
But that holistic experience, the warmth of the mug, the quiet environment, the profound feeling of being heard and cared for, it brings genuine, measurable biological relief to my nervous system.
Exactly.
My heart rate drops, my cortisol levels decrease. The context of the care provides the healing, even if the tea isn't technically medicine.
The context of care is a biological intervention in itself. And when evaluating this treatment, we have to weigh that holistic benefit against the available alternatives.
Right, like HRT.
Exactly. If a patient's primary goal is to entirely eradicate vasomotor symptoms, The data is unequivocal. Hormone replacement therapy, or HRT, is mathematically vastly more effective than acupuncture.
But HRT isn't for everyone.
Far from it. HRT introduces synthetic hormones into the body, which comes with a complex profile of risks, contraindications, and potential side effects that many women simply cannot or choose not to accept.
Which makes the safety profile of acupuncture its absolute strongest selling point.
Without a doubt.
Looking at the data, severe side effects occur in less than 1 in 10,000 treatments.
That's incredibly rare.
The most common adverse effects are almost negligible, about a 3% chance of minor bruising or slight bleeding at the needle site, and occasionally some temporary drowsiness after the session.
Which some might even see as a bonus.
Right, so you have a fascinating trade-off. HRT is highly effective at stopping the flushes, but carries a higher systemic risk.
Yes.
Whereas acupuncture's specific effect on stopping the frequency of flushes is highly debated, but its safety profile is virtually flawless.
And because of that flawless safety profile, acupuncture becomes an essential tool for specific demographics.
Who are the ideal candidates?
The most vital use case is for women who are strictly contraindicated from taking HRT. Breast cancer survivors are the primary example.
Of course.
The life-saving oncological treatments they undergo often suppress estrogen entirely, plunging them into sudden, severe, and highly aggressive medical menopause.
That must be incredibly difficult.
It is. And because their cancers are often hormone receptor positive, they are strictly barred from utilizing estrogen therapies to manage those intense hot flashes.
Oh, so HRP is completely off the table.
Completely. For these women, finding a non-hormonal alternative method for symptom management isn't just a lifestyle preference. It is absolutely vital for reclaiming their daily functioning.
If someone listening falls into that category or just wants to avoid hormones and decides to try this, what does the actual process look like?
Well, ensuring you are seeing a registered, fully qualified practitioner is step one. They use sterile, single-use, disposable needles. And depending on where they're targeting on the body, those needles go in anywhere from 0.5 centimeter to 3 centimeters deep.
Okay, but the interesting part is what it actually feels like. The notes mention a specific sensation called dicky.
Yes, dicky. Most patients expect a sharp pain, but they typically only feel a tiny, fleeting pinprick as the needle breaks the surface tension of the skin.
Okay, that's not so bad.
And that immediately gives way to the dicky sensation.
What is that exactly?
Neurologically, dicky indicates that the needle has properly engaged the underlying fascial tissue and the nervous system.
So it's a good thing.
Yes. Patients usually describe it not as a sharp pain, but as a deep, heavy, sometimes dull aching, or a distinct tingling radiating around the needle site.
Oh, that sounds so strange.
It is unique. Once that sensation is achieved and the needles are fully placed, the practitioner leaves you to rest for that 20 to 30-minute window.
The timeline for seeing results is also crucial because, this is a financial investment.
Very true.
Our sources note that in the UK, a private acupuncture session runs roughly 60 to 80 pounds out of pocket.
And if you're going weekly, that adds up very quickly.
Yeah. The clinical data suggests it typically takes 3 to 5 consistent sessions to start seeing any statistically significant improvements in your sleep quality or general well-being.
That's right.
But to hit the maximum clinical effect, the data points to a protocol of around 8 treatments, meaning you are committing to about 7 weeks of therapy before you can truly judge if it has rebooted your system.
Managing those expectations, both financially and clinically, is deeply important.
Yeah.
And equally important is understanding the limitations of holistic care. Acupuncture is excellent for managing the standard physiological chaos of menopause, but it is not a diagnostic tool for acute disease.
Right, and this is where we need to highlight the red flags established by the Women's Health Clinic.
We always want you to take the safest route with your health.
There is a distinct line between a standard menopausal hot flush and a symptom that requires immediate medical intervention. If your hot flushes are accompanied by drenching sweats and unexplained rapid weight loss,
Yeah, it's a red flag.
if you develop a persistent fever or a lingering cough,
Another red flag.
or, crucially, if you experience any new vaginal bleeding after going a full 12 months without a period,
Yes, please do not ignore that.
those are red flags. Those are not symptoms you try to manage by unblocking client or releasing endorphins. Those demand a thorough, immediate medical investigation to rule out infections or malignancies.
I'm really glad we touched on that. Safety first.
Always. Well, this has been a massive journey through the data. Let's try to pull all of these threads together for you.
Sounds good.
If you are looking for absolute mathematical certainty, if you want to know if a real acupuncture needle definitively beats a fake blunt needle in a clinical trial for reducing the raw number of hot flashes you experience every day, the medical community is locked in a fierce debate.
And the hardest meta-analyses lean toward no.
Right. The blunt needle seems to trigger a similar response. However, its proven ability to drastically improve your overall quality of life, to downregulate your nervous system, to ease your anxiety, and to help you finally get a restorative night of sleep is incredibly well documented.
Yes, it really is.
And it manages to do all of that while remaining one of the safest, lowest risk medical interventions available.
Which leaves us with a truly profound concept to consider about the nature of medicine itself.
Oh, what's that?
Well, in modern clinical research, we spend millions of dollars and countless hours trying to mathematically eliminate the placebo effect from our data.
We treat it like an error.
Exactly. We treat it as a nuisance, a statistical variable that needs to be scrubbed away so we can find the real mechanism.
Right.
But think about what this deep dive has revealed. If a perfectly safe, side-effect-free ritual one involving a quiet environment, empathetic care, and mild physical touch can effectively trick our brains into releasing native endorphins.
Turning down our internal thermostat.
Right, improving our sleep architecture and giving us our lives back. Perhaps we are looking at the data backwards.
Instead of asking how to mathematically eliminate the placebo effect from a spreadsheet, maybe the medical community should be asking, how can we intentionally harness the mind's incredible, scientifically proven power to heal the body?
It's something to think about.
The internal thermostat might be completely broken, but it turns out your mind might just hold the manual to reboot the entire system. Thank you for joining us on this deep dive. Keep asking the hard questions, keep exploring every option for your health, and we will catch you next time.